If you click to this video, there is a good chance that you've been thinking these things. Is this trigeminal neuralgia? Why does it flare up? Why is my MRI normal? And what actually helps? Today I'm doing trigeminal neuralgia fuck. So I will be answering most common questions people ask online, and I'll keep it practical and calm. Quick note still. This video is only for the education purposes, not for diagnosis. If you have a severe sudden facial pain or new neurological symptoms and you are not sure what's going on, get assessed by medical professional. Alright, now let's go. I'm Janne SAKKINEN, physiotherapist, and I work with the persistent pain, jaw tension, headaches and complex facial symptoms. And I focus on explaining what's happening in a way that reduces the fear and gives you the plan. What is trigeminal neuralgia in simple terms? Trigeminal neuralgia is a condition where the trigeminal nerve becomes hyper-irritable. Most people describe the pain as a sharp, electric shock-like attacks at one side of the face. The attacks usually are short, seconds or maybe minutes or two, but they can be repeated many times per day. Typically, when we have a nerve-related issue and when the nerve is with the myelin sheath, the symptoms are really rapid and fast. When we are dealing with the pain, what is not coming from the nerves, what doesn't have myelin sheath, then during that kind of cases, the clients experience the pain in a way that it feels like water is dripping or something is bleeding from that area, or it's really different compared to the myelin sheathed nervous system issues. So those are the two differences about the nerve issues. Why it always feels like electric shock? Often yes, that is a classic pattern, but some people also have constant background pain, more like a burning, aching or pressure, and then the shocks are in top of that. So if it's not perfect textbook shock, it still could be trigeminal nerve related, but you need proper assessment. Can both sides of the face be intact with the symptoms? Most often trigeminal nerve issues are one-sided. Bilateral symptoms can happen, but it's less common. If you have strong symptoms in both sides of the face, that is one reason to get your thorough medical evaluation. Which part of the face can it affect? The trigeminal nerve has three main branches. That's why the symptoms can be shown up in around the eye or forehead, cheek or upper jaw, and lower jaw and chin area. So yes, people often think it's teeth, sinuses or TMJ first. That confusion is really common. What are the common triggers for trigeminal nerve issues? Typical triggers are surprisingly small things. Touching of the faces, watching of your faces, brushing the teeth, chewing, talking, or for example cold breeze. That's why people feel like I'm scared to live normally, and I get it. Can stress make trigeminal nerve pain worse? Stress usually doesn't cause trigeminal neuralgia by itself, but it can absolutely make your flare-ups more likely. The stress changes the sleep, breathing, muscle tone and pain sensitivity. So managing the stress isn't the cure, but it can really reduce the load of the system. Why my MRI is normal if the pain is real? And this is a big one. A normal MRI doesn't mean that the pain is part of your imagination. In many cases, the symptoms are from idiopathic background, meaning that we don't see clear cause on imagining. The nerve can be still irritated or sensitized, but you cannot see that in MRI. MRI is often used to rule out serious causes on the background, and that is it. Is trigeminal neuralgia always caused by blood vessels? Not always. In some cases the blood vessel can compress the nerve, or in other cases there is no clear compression seen. And in some cases the pain is linked to other conditions like MS disease, multiple sclerosis or post-viral nerve irritation. That's why the medical workup matters. How do I know is this dental pain or nerve pain? Dental pain is often more consistent and localizes to one tooth. Trigeminal nerve pain is often shock-like, just like previously described, triggable by light touch, and it doesn't behave like a typical inflammation. When we have these inflammation symptoms, typically when we are at the rest, the cells are having those inflammation cells coming to that area, and at some point the pressure underneath the skin is so severe that it forces you to start moving, and typical inflammation pain is felt like that. But, and this is important, only proper dental and medical evaluation can separate these kind of symptoms. Can TMJ or bruxism cause trigeminal neuralgia? TMJ issues and bruxism can absolutely create facial pain and headaches, but classic trigeminal neuralgia is nerve condition with very specific pain pattern. What's common overlap? Jaw tension can increase the sensitivity, nerve pain can increase the guarding and the clenching. So the answer is, sometimes they are separate, sometimes they are interacting with each other. What should I do during the flare-up? During the flare-up, the goal is to calm, not aggressively stretch. Keep your jaw relaxed, avoid forcing the range of motion, long exhales to improve the parasympathetic nervous system, gentle tongue position and reduce the triggers. If you want, I have separate video showing my flare-up drills step by step, but big rule is calm first, movement comes later. What should I not do when the trigeminal nerve is irritated? Do not aggressively stretch, do not forcefully do nerve glides, do not do strong self-massage or touch the trigger points, and you don't need to be pushing into the pain. More intensity is no more progress, especially with the nerve pain. Does medication help with the trigeminal nerve issues? Yes, many people can get relief from the medication that reduces nerve firing, but medication choice and dosing is medical territory, and that conversations need to be done with your doctor or neurologist. If you have been struggling, don't just suffer, talk to someone who treats the facial pain often. When I should consider procedures or surgery? If the medication doesn't control your symptoms or side effects are too heavy, doctors may consider procedures. There are different options and the right one depends in your case, imaging, age and how the pain behaves. This is a specialist territory, but it's good to know when there is options beyond just live with it. What is the most important mindset shift with the trigeminal nerve issues? Stop thinking only in terms what's wrong with my face. Start thinking, what makes my nervous system feel threatened today and how do I reduce that load? That shift alone changes how you respond to the flare-up. If this video answered your questions, excellent and great. If you want, comment your questions down below, and after that, when I get those questions, I can do this follow-up video for this. Also, if you want the practical drills, watch my flare-up video and the neuromobilization video next. Calm first, move later, and thank you for your time.